moving along for a major expansion at Strong Memorial Hospital. By 2027, the emergency department will triple in size with an additional 9-story tower. It comes at a time when many hospitals across the state are overcrowded and understaffed. Eriqueta Koss is following these developments for us today. She joins us now live with the latest on all this. Eriqueta.
Good evening, and the tent you see behind me is just an example of one of the short-term solutions that they've come up with to alleviate some of the crowding you mentioned. The current emergency department design is designed for about 55 to 60,000 people a year, but is actually taking double that. Not to mention, when all is said and done, they're going to need the staff to fill it as well. Hospital leaders are calling it the largest project in URMC's history, with $1 million of federal funding going towards this. It includes tripling the size of the emergency department, offering more than 100 new private rooms in the form of a 9-story tower.
We're finally into the construction phase, and you can see all the work that's going on around us here is to prep for that. And where we are standing right now, we'll have a building around us and above us.
Dr. Michael Kamali says the temporary structure you see here has been helpful throughout the pandemic as a short-term solution to the crowding. But in the past few years, even before COVID, they've been planning long-term as well.
We certainly need the space as we're bursting at the seams for anyone who's been inside the emergency department.
Van Yanis, director of special projects, says at no point in this project will any current patients be affected.
Some internal operational flows that we've adjusted, mainly with our loading dock. The loading dock was directly adjacent to the ED. So with our new plan, we do actually get to separate those. So you have a dedicated ED entrance, a dedicated loading dock that has space in between to allow for easier access for both ambulances and ambulatory patients.
And with the new space comes a need for more staff, says Dr. Kamali. It's a process he says is always ongoing.
That's something that we'll need to tackle in the coming years, and something that we've been tackling recently also.
Hospital leaders say they're working to recruit more staff by offering career advancement pipelines. They say they're working to offer competitive pay and more support services for employees. As for the tent behind me, I mentioned that short-term solution that will be there for the next few years, we're told, as this project continues to unfold. In Rochester, Eriqueta Koss, News 8.
Eriqueta, thank you so much. A statewide disaster emergency still in place today because of those healthcare staffing shortages. Now, a portion of the governor's 2023 budget going towards a worker bonus program, payment reform, and increased home care worker minimum wage.